You, Gary, will you pass that down right there? It's a test.
I guess there's enough for each of us.
Well, we are a tiny bit late due to a small mechanical malfunction, and we apologize to our members who were forced to stand out in the cold. Sorry about that. So I'm going to call to order the regular meeting of the Dunn County Health and Human Services Board for April 28th, 2022. A slight deviation from our normal procedure. We have new members who perhaps are already thinking that they wish that they joined another committee. And I think that it would be advisable for us all to introduce ourselves and the staff. So I'm going to start. I'm Diane Morehouse and I'm the chair. Chris, do you want to start?
Sure. I'm Chris Corpola. I am the Health and Human Services Director and have been here, been in this role for about 9 years. But I've worked for the county for about 20, a little over 20.
Greg?
Greg in the Veterans Office. I've been with the county for a little over 10 years.
And up on the screen, please.
Hey guys, I'm KT Gallagher, Dunn County Health Department. I've been in my role for 4 years.
And since we're on the screen, Dr. Hall, would you introduce yourself, please?
Sure. Hi, I'm Alex Hall. I'm a citizen member and I'm a physician and I teach biology at Stout. Welcome to the new folks. Sorry that I'm virtual, but I have a cold. So here we go.
Ms. Barker.
I'm Bonnie Barker. I'm a citizen member and I am the Director of Special Education and School Psychologist in Boyceville for at least another month.
Okay, Bill.
I'm Bill Lamb. I do legal, regulatory, and business development stuff for a design build firm in River Falls called Ross & Associates. I'm a citizen member. And welcome to the two of you. We've met up front, you know, so good to see you. Good to see everyone else too.
Gary.
Gary Steen, Vice Chair of this committee, also the Dunn County Vice Chair, a longtime member of this community and our community, this committee. And thank you for joining our group. We did want to have you in there. It was a mistake that you were locked out. But we blame Diane. So.
Yeah, blame it all on me. Hilary, please.
My name is Hilary Robinson. I do not work for Dunn County. I work for Associated Bank, and I'm super excited to be here. And it's still cold outside, in case you were wondering.
Hi, I'm Andrew Hagan. I currently work at Drylock in Eau Claire, and I've been self-employed before that for about 10 years or so, and I grew up on a family farm. So I have a wide range of personal experience.
Wow, thank you. Thank you. And joining us in the rear is Barbara Fagan, who is the Assistant Corporation Counsel. Do you want to say something else?
Not really. I'm here as legal counsel for the county, and so it's good to meet everyone and see you today.
Thanks, Barbara.
Diane, could I just speak to the citizen member issue, just so that our new people understand? So the Health and Human Services Board obviously is appointed by the county board chair, but it has some statutory requirements. And we have incorporated the statutory requirements for the Public Health Department and the Human Services Department in terms of what the composition of the board looks like. So one member of our board has to be a health provider professional, which is why we have Dr. Hall. And then the composition needs to be, is 5 county board members and 3 appointed citizen members. And Bill's been with us about 10 years as a citizen member. And Bonnie, what are you, about 6 or 7?
Yeah, I'm thinking so.
Yeah.
I think it's
as-
that.
As citizen members, a citizen member, and then Dr. Hall's been with us for about a year.
1 year.
Yeah. So,
Miss-
and so the county board appointments are 2 years. And I'd have to refresh my memory. I think the Health and Human Services Board member appointments are 2 years as well. They're just on a different cycle. Are they 3? I
The
get
board
confused between
members?
the advisory committee.
Yours are 3.
They're 3?
Yeah,
Okay.
I'm looking at this list.
All
that
right.
Somebody nicely put together.
Yep.
Ms. Barker, you've been on the board since 4 of 17.
There you go. So that just speaks to why they said that they're citizen members versus county board
Okay, does
members.
that make sense? Okay, then yes, I'm sorry, Supervisor Steen.
Chris, would you like to also mention, or Diane, per diem?
Yes, so, as citizen members, and maybe, the clerk's office spoke with you about that, but you do receive a per diem for attendance at this meeting. I have those, filled out for you, so all you have to do is sign them. And then I will turn them in on your behalf. The county board members track their time for all of their meetings for the month, but for you guys are not though.
Yeah,
It's
no,
all
they-
citizens,
you're
sorry,
gonna do
I'm
your own.
confused. You guys will do your own.
Yep,
Okay.
you
Yep,
will
sorry.
do your own.
Just citizen members receive their per diem as well, and I track them help them track them.
Yeah, and generally speaking, I think some people submit their per diem requests quite frequently. I usually wait a month or thereabouts,
Okay.
so.
Makes
Okay.
literally no difference in the system.
Yeah, it makes no difference.
And the committee meeting is it the 50 or the 60?
The committee is 50
Okay, and the supervisor.
per
is
meeting,
60.
and in the supervisors and the county board meetings are 60.
Gotcha, okay.
And mileage.
And mileage, should you accumulate mileage, although not on the way to and from meetings, should you attend a conference or something. And you may also ask for compensation for internet provision at home and so on. And I believe that's $40 a month.
Yeah.
Okay, all right. We're going to do something else, just very unusual tonight. One of the things that I learned when I first came on the county board is that you have to pay attention to what happens, because you sort of have to model behavior on the way everybody else behaves. And there isn't necessarily a lot of instruction in that. So we're going to have a tiny little exercise in Robert's Rules of Order, so you get a little sense of how we work in meetings. Mr. Lamb, do you have one of these? Everybody have one? Okay, except our colleagues online. So I'm going to read the questions, and everyone can feel free to just answer as you wish. All right, question number 1. Robert's Rules of Order are intended to blank. Any ideas? Answers are helpful.
Provide procedures for conducting meetings and legislative sessions.
Okay, provide procedures. Supervisor Steen,
Maintain an orderly meeting.
correct? Anything else? The other reasons are to protect the rights of the majority and to assure the rights of the minority. Did you have that
I
answer?
said protect the people.
Yeah, to protect both the majority and minority rights so that we both have orderly procedures and people's rights are honored. All right, question number 2. This is a hard one. Counties have broad authority to act for the health, welfare, and safety of their citizens. That's a true or false?
I said false.
Mr. Lamb, and say why.
It's the authority is given to them via statute. So it's within that statutory authority that they can act, not outside.
Yep, that's absolutely correct. Counties are the statutory child of the state. Most of what we do is mandated by the state. It is in statute. We are generally speaking, not able to act outside of state statutes. Can't draft ordinances that are more stringent than state statute and so on. So we don't have unlimited authority, or they call it home rule.
Is that true or false?
That it is false that we have unlimited authority. Okay. Question number 3, a quorum is?
Dr. Hall was raising her hand.
Dr. Hall, thank you.
Oh, sorry, I was just saying, no, for this group, isn't it, we have to have 5, you have to have more than half of the members?
That's correct. We need the minimum number of people who can legitimately transact business. So for a committee of 8, the majority is 5, and we were all anxiously waiting for us to have to reach 5. Okay. Items or business to be discussed must be blank.
On the agenda.
On the agenda is the correct answer. Excellent. Can't discuss anything that is not on the agenda. Mr. Lamb.
I have a question.
Hmm?
If something's on the agenda and you're discussing it, and as the discussion goes along, all of a sudden you realize, well, maybe it'd be best to further this discussion in closed session. Can you go into closed session without, even though potentially going into closed session wasn't on the agenda? Barb?
Ms. Fagan, I think we cannot go into closed session unless it's agended. You could move to table or to postpone to a set date. Yeah.
I think.
All right, thank you.
Barb, also that when you notice the closed session, you have to notice the reason,
Yeah.
Whatever it is, section 85, parent 1, parent C, whatever it is. It's specific to what you're gonna talk about in closed session.
Yes, and in a general sense.
Yeah.
It doesn't do very much good in closed session to then say exactly what is going to be
No,
discussed, but in a general sense.
I think you have to state the statute that covers what you're gonna do.
Yes.
Yeah, I believe so. Number 5, a member wishing to speak must be recognized by the chair. True or false? Supervisor Steen.
Miss Chairperson. The answer is yes.
That is true. Yes, person wishing to speak must be recognized by the chair. The answer will be funny on this one because we're a little informal at the moment. But number 6, members of the committee are referred to by their proper names. True is the answer. The actual answer is false, and it will feel a bit formal. It is Dr. Hall, Ms. Barker, Supervisor Hagan, Supervisor Robinson. That's just the way we maintain decorum at the county board. Until a member, question number 7, until a matter is brought before the committee in the form of a motion, it cannot be debated. True or false? True, that is correct.
Actually, the form of the motion, it can't just be a motion, it has to have a second.
Yeah,
Then you can have.
it has to be a motion and a second. It has to be restated, and then you can have debate. All right. To modify a motion, you would say blank. Supervisor Steen.
Madam Chairperson, I would move to amend.
Correct. Move to amend. This is a trick one. Number 9, actions by committee require a motion, a second, and a 2/3 vote.
That's a lot.
True or false? I'm looking at Supervisor Hagan.
Madam Chairperson, I say false does not need the 2/3 vote.
Absolutely correct. That is correct. Most are approved by a simple majority. The member proposing a motion may speak at any time during debate. Supervisor Hagan.
Madam Chairperson, that is another false one, because everyone needs a chance to talk after each person talks.
Correct. The person proposing the motion is allowed to speak first. And after everyone else has spoken, then the member proposing the motion may speak again. Generally speaking, only twice. We're not quite that formal in committee, but. All right, number 11, we're almost done, I promise. A member objecting to a process raises blank. The way we are doing business, if you object to it, what would you do? Mr. Lamb.
Excuse me, I'm chuckling. Raise a point of order.
Correct. I raise a point of order, which doesn't require a motion or a second. All right, finally, according to Robert's rules, discussion must be open and free flowing. True or false? Supervisor Steen. I believe that you are correct. It is false. Discussion is reasonably regulated so that everyone has a chance to speak. And that meetings are reasonably businesslike and reasonably time efficient. Okay, I don't know if everybody feels that that was silly, but I hope it might help a little bit in the way that we behave in meetings. First item of business, number 3, approval of the meeting minutes for March 24th, 2022. I need a motion to approve. Supervisor Steen moves. Is there a second? Supervisor Hagan seconds. Any discussion, additions, or corrections to the minutes? If not, all in favor say aye. Aye.
Aye.
Any opposed? The minutes from the Dunn County Health and Human Services Board for March 24th, 2022 are approved. Are there any public comments? We received any?
No.
No public comments. Number 5, review of the next meeting date, and this is on me. I did look at this agenda 3 times, or maybe 4 times before it went out. And the next meeting date is actually May 28th, not April 28th, which happens to be today. So the next meeting date is May 28th. Hopefully that works.
Let's maybe double check.
Double check that it's the 28th.
May 28th is the Saturday.
I was gonna say it's.
Oh, so it's be the 26th. I'm sorry. The next meeting date will be May 26th, Thursday, May 26th. I know, right? Also, some save the dates, which may be a surprise to our newer members. We are recruiting and interviewing for the next Director of Human Services. Ms. Corpola is leaving us, unfortunately, in August. And we have dates set aside for those interviews. We're trying to do them later in the day to make it easier for working folks. But we've actually calendared the 10th, the 12th, and the 13th. 11th is an executive committee meeting.
Tuesday, Thursday, Friday.
Tuesday, Thursday, Friday, 10, 12, and 13. We will do some initial screening on the applications so that we can schedule the interviews and get this out to you as soon as possible. We'll have to call for a meeting of the Board of Supervisors with provision to close comment.
Do you want to speak to the board's role in that? Why that's happening that way?
Why don't you?
All right. So the reason that the Health and Human Services Board will be a part of those interviews is because depending on the type of government, but just, depending on the type of oversight to a county, depends on how the Human Services Director is hired or appointed. So if you're a county executive or a county administrator form of government, the county administrator or executive appoint the Human Services Director subject to approval by the entire county board. If you're an administrative coordinator, or as we call a county manager form of government, then the Health and Human Services Board is appointed by the Health and Human Services Committee, and they're the final say. It is not a final approval by the county board at large. So you will actually be the hiring committee to the Human Services Director role. And I believe the intention was, originally your intention was to have Human Resources Director ask the questions.
Yeah.
And other people be observers
Yes,
to the
that-
process.
Yeah, that's correct. And the Health and Human Services Board agreed that the full board wanted to be a part of this process. So subcommittee, Supervisor Steen, myself, and Dr. Hall have met with our human resources people. We mapped out qualifications, criteria, looked at a job description, and then approved a process in which our human resources department will be doing the actual interviewing. We will be present for the interviews. And then following that, we will decide whether, as a board, whether there needs to be a second interview scheduled with any of the candidates. And then the whole board will be acting to approve a new human services director.
Miss, you go ahead. young lady.
Madam Chairperson.
Yes,
is that how I address
Supervisor
it?
Robinson, you don't have to say that, just raise your hand.
Okay.
Supervisor Robinson.
Do you already have candidates for this position?
The position announcement closed on Monday, and we do have applications.
Okay. All right, thanks.
Madam Chair, just as a
Yes,
point
Supervisor Steen.
of information to go along with what Chris said there. This is the only committee in the county that does this, that has the power to hire. Just to kind of flesh that out for
Yeah.
you. The rest of the time, the normal procedure would be HR advertised, and they would handle that, and then it would come back. But also too, that the whole county board always has the final say on whether somebody gets hired or not. Has to be approved by the whole
Correct.
county board.
Not this one.
Well, yeah,
Yeah. Other
This is
positions.
statutorily different.
yeah. We call the shots on this one, but otherwise, the whole county board reacts to whatever the executive committee and the HR people bring to them. I think that would be the.
Supervisor
normal way.
Hagan.
So would this be a unanimous vote or majority vote for the candidate for hire? Is it everyone agrees on the person or?
You know, we have not discussed that. I am assuming that it is going to be a majority vote.
Okay. Just point of clarification.
Yeah, it's a good point of clarification, and I will follow up on that because I wasn't sure I had the answer
I'm
immediately.
not sure either.
Excuse me again. there.
Yeah, Supervisor
Madam Chair.
Steen.
Diane and I, or Diane has decided, and we as a board decided that we're going to really keep track of the procedures that we do in this case. And so we can have a template when this happens again, so that we'll have, an idea of what we're doing and make it a little bit easier. And that's also what we're going to do, just as a point of information from the hiring for the county manager.
Madam Chair.
Yes,
I believe that Mr. Lamb could speak to the fact that I think that in the last round of hire, it was essentially a consensus decision. It wasn't a formal action in terms of a vote, but it was a consensus decision, if I recall correctly.
Boy. I think that's right, but. Yeah, it was. We didn't go around, and if by that you mean didn't go around and say yes or no individual. No, we didn't do that.
Okay.
Yeah.
The group reached whether or
Reached
not
out,
all members
exactly.
agreed or
Yeah.
didn't, came
I
to
had-
a conclusion about.
Yeah, I had to think back.
And there should be sufficient opportunities for discussion it's likely that outcome would be achieved, but it's hard to know. And I will double check that. Okay, any further questions on this? We'll let you know as soon as possible so that you can get these dates in your calendar. Number 6 item placed at the request of the chair, options for orientation. We've not done formal orientations because we have been laboring under COVID for so long. But we think that it would be extremely helpful to have an orientation. Not only is this committee and its structure different, but our portfolio of programs is pretty large. And the services provided are pretty complex, and it takes a long time to try to understand what's going on. So we thought an orientation session would be in order. I will let the staff comment on how they think it should be done. I think it would make more sense for our staff time to try to do a group orientation for new members and for any other members who choose to participate. I think I will join. And then perhaps to schedule a visit to the department and meet the staff and so on. So I think a group session would make some sense, but I'll let KT respond, and Chris, how you think this is most efficiently accomplished. KT?
Well, I understand in the past there has been that large group orientation, but I also see value in a one-on-one to be able to walk our departments, to meet our team in a HIPAA compliant way, and be able to ask questions and be invested in the work that we do. So I'm very open to meeting the board's desired need.
Chris?
Yes, so historically we have done historically as in pre-COVID, and probably sometime because our board has had relatively stable membership for the last, I believe, almost 6 or more years. So probably since Ms. Barker came on, but but we did do an orientation with some if there was more than one new member, inviting all of the new members and then anyone else who wanted to attend, and then an option to just kind of go through that program review and budgets and all of those overview of all of those sorts of things. But it could be however you believe it would be most helpful. There's no set to it.
Got an opinion. I think it's important to see the footprint that we work within,
I do too.
and also to know that you come by, you pop in, say hi. It's one of your programs, and Harry stops in and says hi, and others have. So I would definitely want it. I would want that to be part of it.
Okay. Right. Well, new members, you could state some preference whether you would like to do this as a group or whether it feels more appropriate to schedule one-on-one. In which case, I'll leave it to you to schedule with the staff.
I would feel like it would be good to do it as a group, just from like a streamline kind of thing. But I mean, to me, I feel like it rests on your shoulders, KT. If you would be the one facilitating it, like, what do you have time for?
Well, I think each of us would speak to our own program. So it would be Chris, Greg, and myself. But I think there is some value in collective learning, and we can absolutely add to that afterwards. I'm happy to facilitate, but we'll only speak to my own programs.
So I think you probably could set up a time to do overview and then spend some time in with each of the departments. Just to see, like Greg says, the layout, the footprint, meet whatever staff might be appropriate or available.
How about if we share, I can ask the staff and share via email a date or two for a group orientation, and you can then follow up. And I will join you because I think this is a good idea. And then each of you, if you want a one-on-one tour, can follow up individually. Does that make sense? We'll get that out in the next day or two. Yes, Dr. Hall.
So I'm excited for this. I love field trips. And I love, I feel like just after a year, like I finally have a pretty good handle on all of the different functions within the departments. But there's nothing like hearing it from the people who are doing the work. And I think doing kind of a group thing to start with, to kind of maximize the efficiency for all of our staff would be great. And then if people want to arrange kind of one-on-one stuff for a little bit deeper dive later on, I think that might be the best way to tackle it. So I'm excited to have the opportunity to learn more and meet some more of the staff too. So thank you.
Yeah, I agree with you. Thank you. We'll get that taken care of in the next couple of days.
Could I just ask a
Please.
question? Could you just speak to what your availability is, kind of days, times? I mean, not so much specific, but like, does during the day work? Is that complicated? Would it need to be at the end of a work day or in the evening? Just whatever, because we can accommodate whatever you need.
So right now, my work schedule is a rotating weekly 12-hour workday. So I'll have like Mondays, Tuesdays off, then work Wednesday, Thursday, then work on Friday, then the weekend, and then it'll switch. I'll have Monday, Tuesdays off. So yeah, it's a fun schedule. So it all just depends on what week in the future this gets planned on. But I can certainly work with my work to swap days with someone else or whatnot. So I'm pretty flexible that way.
And when you say 12-hour days, what does that look like in terms of what time to what time?
7 a.m. to 7 p.m.
And I work from 8 to 4:30 Monday through Friday, but I can take PTO.
Okay.
So,
Well,
I will try to minimize that for you.
Yeah, we'll
I
play with
have-
some.
I have some
flexibility.
volunteer PTO that's specifically set aside for volunteer time, so I could bump it under that. So.
All right, we'll see what we can work out. Thank you. All right, moving on to business.
One other question, I'm so sorry to interrupt.
Certainly, KT.
Madam Chair, can you help me remember what numbers of folks do we need to appropriately notice the meeting if we have 2 new folks and then Dr. Hall and yourself, then we're looking at 4. If we have 5 or more, will we need to notice that meeting?
Yes.
Yes. Yes,
You have 3 new members and Dr. Hall. so
with 3 new members and Dr. Hall, and if I join,
that's
yeah,
5.
that's 5.
Madam Chair, respectfully, I would just notice it regardless because maybe Supervisor Lamb wants to join unexpectedly or something.
All right, well, so we'll set the date and then we'll publicly notice it. Thank you, Ms. Fagan. All right, moving on, Veteran Service Report. You're on, Greg.
Good evening. Good evening, everyone. So included in your packet is a little bit of a narrative summary on the particular activities over the last month, have a workload report and then budget report. So I'll start with it's the document that looks more like a memorandum format that's in your packet. To report this last month, I break the report down basically on local engagement activities, and then we'll discuss state benefits activities, and then on the federal benefits, and then hit any highlights or anything significant on the financial side. So this last month did 3 different outreach activities and just attending. So I spoke earlier with kind of about a homeless shelter forum that had been conducted, and the reason for my presence or our office taking an interest in that, locally there was a transitional house for veterans called the Community for Veterans, which has now that program is no longer. There is a local homeless shelter that is in Chippewa Falls, and so we need to definitely support any activities to increase housing options for those that are homeless. And so kind of got a little bit of update on some activities that Stepping Stones is doing. So we got some good things and opportunities, I think, for the whole community, but specifically the population that I serve. I want to make sure we're aware of all the options. I did just a brief meeting with 4-H, and if you wonder why am I talking to 4-H, because those are future veterans, could be. So if they're aware that there's activities in office, and I gave a little bit of historical stuff as well about Memorial Day, and then in working in collaboration with the Veterans Health Administration, and I'll speak in more detail for newer supervisors on different acronyms. I'll make sure that I spell them out, and when we do a more in-depth discussion about kind of our outreach and activities and the programs that we're involved in. But we work in collaboration with the Veterans Health Administration, a social worker who's dedicated to healthcare enrollment for veterans, and try to hit that newer veteran population, which is typically some of your students on campus at Stout. We'll also, during the year, we'll attend event at the Chippewa Valley Technical College, and then any other opportunities. And the greater benefit, if the more engagement we can get for the newer veterans in the healthcare system, ultimately it can take and save money, even within the Health and Human Services Department, because if there's any type of emergency room stuff, or they'll sign them up for Medicaid or things, if we can get them enrolled in the VA for healthcare, there's another federal option that takes that burden off of the county. So there's that's the rationale behind it, and ultimately we don't want anybody that is neglecting their health because they think that they may not have cost-effective healthcare. And from that meeting, we actually pulled a couple of staff that knew we were there, so they popped in and helped them out with some of their benefits as well. Actually, I'll be meeting with the majority of them next week. But it's a good partnership, great social work from the federal VA that have been working with on these events actually for over the last 10 years. On the state benefits through with Wisconsin, there's really nothing significant to report, but just broadly to explain, there's state educational benefits for veterans and dependents. There's an Aid to Needy Veteran Grant, and I'll speak to the Aid to Needy Veteran Grant through my annual report, which is really not much to talk about other than my recommendations for improvements to the state on that. And so there's some other small business related items and stuff that we don't engage in, because there's other programs that help develop business plans and stuff. We just make that connection. We focus on those immediate needs for veterans and their dependents. On the federal level, I'll just quickly say for tonight's meeting, the federal VA has 3 legs to it. First acronym, VHA, Veterans Health Administration. All that particular federal department cares about is treating veterans' medical needs. The next acronym I'll mention is VBA. That's the Veterans Benefits Administration. That is compensation, disability payments that go directly to veterans and their dependents, and a pension, which is an income-based program. And that third leg is the burial cemetery programs. Specifically of importance right now, within now it's within the Senate. There's and I should have wrote the acronym down. It's honoring the PACT Act. But basically, what it is we have a large number of veterans. There's a misconception that you serve in the military, you get health care. That's incorrect. You have to qualify. You qualify. Restate that. Every veteran is eligible for health care, but it's if they're going to see you or not. They prioritize who they see from if you're injured, you're disabled, income wise, and then certain exposures. Most notably, we hear about Agent Orange exposure. And so now we have a whole new crop of veterans based upon a variety that you hear burn pit, but it's more particulate matter from the Middle East. So they have this new law that's being proposed. It's anticipated, and the reason I know it was a little little forward to put in there that it's anticipated the president's going to sign by July. However, I heard it directly from the Milwaukee VA regional office, their director. So got to be true. So, and he just indicated a lot of momentum behind it. There's a lot of support for it. And part of the reason they're not looking like there's going to be much opposition is because our current administration, the president believes that his son that had passed away from really kind of a rare brain cancer, that was due to some of the exposures from overseas. So there's momentum behind that, but they're anticipating it's going to open the door to a lot more enrollees in the VA for healthcare, covering some of these special qualifiers. And I'll go in more detail. And I try to each board meeting to kind of hit a benefit. So kind of an educational process as we go forward as well. So that'll be a big thing. Plus, there's a number of what are identified as presumptive diseases. And I'll use a simple example. Those that were exposed to Agent Orange during the Vietnam War, if you develop prostate cancer, it is considered presumed to have been caused by that exposure. There's no argument, there's nothing. We just submit paperwork and they go ahead and award it. They're adding a number of those. There's, I think, 5 cancers, respiratory related cancers for all the new veterans that I say new, but I'm talking from 1990 forward from being in over in the Middle East. So that's a big news. They got all their actuarial lists, crunching numbers on this. So that's some of the debate going forward, how much it's going to cost. But that's going to be a very, very big improvement. And I'm looking forward to that being passed. So the next financially, we just finished up first quarter. There's nothing significant to report, and there really shouldn't be anything significant to report this early in the budget cycle. And I'm just kind of keeping the same process forward. I don't know. I'm going to take the guidance from our new county manager when that happens on if we remove the reporting about our COVID preparedness and emergency preparedness. So I just keep that in there, fully staffed, running business as usual, and as we have been throughout the whole pandemic. And just staff update. We're small office, small budget. Very tax levy heavy with our particular program. And so we use volunteers. We're very thankful for the volunteers that we have, and we have one intern. I always try to use any students that I can to come in to do internships, because it's partly a mutually beneficial relationship on what they're getting from our office and what we're getting from them. But I'm also creating some of our future bosses as well, and have a little bit of influence over that. So I definitely appreciate being able to do that. If there's no questions, I'll move to the second document. And so everything is try to show is and quantify what we do. It's not because output is important to show the relevancy of a program. And so this is what we've come up with, identifying and categorizing some of the things we do, and being able to do a comparison from year to year. I did not put last year's 2021's comparable in here. I'll make sure that I provide that as we go forward. But there's been a couple changes. We have officially switched veterans management systems, basically the case management, client management program we use. And so we had to change our report a little bit because there's some reporting functions that are not the same from one to the other. So I'll draw your attention to item 12 on the category. We're going to start tracking retroactive payments. I provide impact statements so people can get just a visual of, hey, this is the type of situation or the efforts and the outcomes that happen within that office. So we'll always include a couple impact statements, but retro payments just identify cash money that comes in to a veteran or dependent's account that impactful and makes a huge difference because they're going to spend that money in our county, and that's important to know that. Open actions is another highlighted item in number 11. That's going to be a future tab. Waiting on an ad hoc report to be fixed so I can kind of show, because Supervisor Steen always asks, like, how many you got open? What's going on? And so I want to be able to capture that, but we've got to get that corrected. And it was easier in the previous system. And I'll highlight our medical equipment loan closet. If newer supervisors, if you've seen it or heard about it in the community. So we manage a medical equipment loan closet, and questionable if it's in the right location, but I don't want to give it up with our office, because we end up having a firsthand direct discussion with somebody coming in. They want to get a walker because they're having hip surgery, knee surgery, and we have on our form, are you a veteran or not? They say, hey, I'm a veteran. Or if they're going through some cancer treatment, like, hey, you're in Vietnam, you have prostate cancer, let's take care of you. We got you. And we'll get them enrolled in healthcare, and even dependents will come in because they're getting a walker because they have loved ones that's at the Neighbors of Dunn County, American Lutheran Home. And we're gonna ask them if they're a veteran again, because there's a financially based programs that we might be able to help defray some of those costs. So it's an in-house outreach, if you want to call it anything. So it works out, and so it gets utilized, and we just quantify how many pieces go out the door there. And then the other, I won't elaborate too much more on some of the other benefits, and we'll get an opportunity to in training could talk specifics about what we're handling as far as benefits applications, interactions, crisis intervention, police contacts, things of that nature. So I'll move down to the impacts. You see that first one, where the benefits and offs, then to benefits from many years ago, and anyway, the outcomes are how to find the percent of the market. And the side is the individual basic is how to factors and how to be filmed. So as an and do a notable push transfer for the military state when the big system will and also the process. And another quick individual that really about 7 years ago, that is our first wasn't for that's not they run that new song that's still every other. And so then it has this career significant health and anything involved in the engagement of all that group. Last part is provide the statutes for drugs. So we'll run like sales and I go to work. I think that those are online, and I and I reports have to be created by all of a year in the summer before. So the second day of the year, we're going to have to work about citizens and non-citizens. Some there, any questions you have on page 3. I'll carry the effect of for us. But some of the things are to the point. I mean, I study also we got to do some sense and I know they want to be not here the record featuring the template to make probably this is the idea and I actually right and the side usage budget is also the donations and donations that's more than for me. Last in my robots and any other but the organizations that have it we are and want to for and here that we try to treat the $10. The federal state benefits get $1 $3 $1 there that's into the money for us in some companies as federal cash or solutions and aim when that's very dealing with on the side the reason that the initiation was and that is for the development on was to last year as I understand on the so that is no area is about the that's how role on the efficiency here is for not for municipal services that's probably right multiple things that is awesome is on the record the same as the tax will be already good for the from the and everyone's only technical use it also on the first stage of group is usually about 85 years I want to do the partners you can get a position for the position for on the side you can make the money of fruition but you're the same as the years sales the information for anyone for years I have been seeing that very little from the today we have to see the approval process. They go back, so you get entry and they get the vote and you're going to board. And most of the programs use forward. And so it's that's the legislation board. I will be the last days all the accidents that all the things are face and ideas to type of challenges. Some people say yeah, this is these days we're not having investors now. Any questions about that? For you and they outsource these actions. So you can make a lot of better the whole and a lot of things. It's all we use 100% of the place to do wheelchair and also do the so the agents. We treat about there's private elders and most male we get sure those it's central understand the actual law and it definitely that there wasn't any serious approvals for information. And then there's percentage use on submit the authors one time they think they'll have to see the election because that is a real factor in there and they have some help on those games moving on to PT Right, we will not put it to consensus. Right, so we're going to start saying a little bit about recycling material from so we have various handouts there for you. Some of those items that go down and so and here there are various participation so on the page you have actually decided what these numbers are now and interesting a little bit about the shoulder everything else around the recently over the last 7 years because something that water based in terms of which I essentially 100% directly become what else you all that. It's much more than that. So it's something like that with a lot of using power which is neat like anti-cooling sound stuff because the ground is on the next page that said what I did last year was look at the actual audit report because there was this to measure what for us what we budget the college money was in the ground that we populate. So we are about 3 million. So obviously in the county's budget we have we are about 70% of county's budget. So we are the team's level size budget which is county budget and the program. So there's concerns that we capture both programming and the services that we're in both in doing that actually and so I do my and this
page. You can see that in our actual essentially with my national years, and you can check it out. And you can see, of course, on the actual number of advice, you're spending between $2.5 million and $1.1 and everything in 0 to $0.8 million. There's a lot of code different elements around and useful things like reading more Zoom options, options, people are going to do something more efficiently. The other documents I tried to do, which is considerable measure, there's also number of times here, you actually begin with the version 22, the directions that will help to the conference in early May, and then additional chapter that will be filed and submitted by the end of May, and then those will get put together to the manager of visual credits. Those all get together into large compilation of all candidates. Here, according to publish workshop, I will review those materials for all of them, specific submissions, and then there's also working to process to the point of hoping that some final issue wraps up, but we'll and it's not a manual year, so it's not because I'm going to use it, but I know that it was it's not research stuff, so and so these documents are all statutory or administrative to provide more to find out these that will be decided below which we intended. There is one language that's so you know has a very responsibility well using the so you know because they then these documents are extremely close. This will walk into this analysis document, which is then the great outside section of cost and then what's revenue like levies as a way to already mean that about $8 million but big categories work out like levies so you know I really think so expensive that because much they can so I have to review because I cannot see my Zoom video so I do budget again new financial projections and I want to do screen it and trying to figure out useful for you there's research with well see some changes this as well I'm sure is not the current way for financial issues for some people and this work ton of data and so that's and she has to nice process out on the work I see so how that is work so people that think still here see people considers are relevant to the and for next to the next argument and all other things you can see and they do much I did and I'm sure so we are on this page for the screen because there's a in very big much here to and for money so you get so our news will come to the play and or we our letters are generated with very much